I'm Jens Seeberg. I'm a medical anthropologist working at Aarhus University. At one level, I think it is an approach to understanding disease, basically. And it is an approach that is linked to the increasing connectedness of people and goods and societies. It's also conceptually, I think, linked to the idea that biomedicine is not enough to understand these phenomena, that a biosocial framework has to be developed. I think an important topic is that health has to be politicized. So there is a kind of denial, in my view, that the problems that are underlying global health in terms of structural violence, in terms of profound inequity, that they should not be discussed in political terms, but they are, of course, intrinsically political issues. The other one is perhaps somewhat linked to it. The role of the state is changing rather dramatically in the recent decades, from a state that is kind of providing services to a state that is increasingly servicing industry and finance interests and protecting the industry. Now, the third one, I guess, is more disease-related. Drug resistance is a product of increased access to drugs, but it is primarily an outcome of drugs being distributed in insufficiently how should I put it, in not sufficiently well-functioning health systems. One of the big challenges, which is rather difficult to address, but which nevertheless is a challenge, is the spread of neo-liberalism. And it is linked to not only the economy, but also the approaches that are used. The second challenge is linked probably to population growth. There are basically too many people, I guess, and that has effects in a number of ways. Or let's say the way resources are divided among these many people is such that it's not sustainable. And the climate changes that are at least partially linked to this number of people that we are all have profound impact on global health. The tangible one to address would be drug resistance, which is something where you have to change the way drug resistance is perceived. Essentially, it is an outcome, or it is a product of uncontrolled distribution of drugs that have been reduced to goods that are sold as any other kind of candy. So labels are probably short-lived in terms of the need to reinvent educations and institutions, but what's in it in terms of critical health analysis will surely be there in some form.